From the News Channel 5 Network, this is OpenLine.
Good evening, Matthew Torres here, and welcome to Open Line on News Channel 5 Plus. Thank you so much for joining us today, and we have a very important topic that we are discussing and a great panel to talk about that, and we are talking about lung cancer and lung cancer awareness. So what I want to do first is obviously go down the line, introduce yourselves and what you guys do. We'll start off at the end.
Right, so I'm Eric Rogan, and I'm a thoracic surgeon at Vanderbilt, and I take care of patients with lung cancer that we can operate on.
My name is Pierre Massion. I'm a pulmonologist. I take care of people who are at risk or with lung cancer, and I also direct a cancer early detection and prevention initiative at a cancer center.
I'm Kathy Leiser, and I am a lung cancer survivor, thanks to the two gentlemen to my left.
So we obviously have the two experts regarding lung cancer, and then we have one who survived lung cancer. So I think we got the scope of everything here. But first off, I just want to mention November is Lung Cancer Awareness Month, hence why we are doing this today. I just want to touch base, kind of the statistics that people may not realize surrounding lung cancer. Of course, we hear about breast cancer, ovarian cancer, and all sorts. Lung cancer, though, where does that fit in the spectrum of diseases?
Well, lung cancer is the #1 cancer killer, period. And more people die from lung cancer than die from breast cancer, colon cancer, and prostate cancer combined. So it's a very deadly disease. And unfortunately, the reason is because most people present in very late stages.
And for you, Kathy, since you were a survivor of cancer, tell us, when were you first diagnosed, and when was the decision to go to a doctor and get the tests?
I actually had heard about Dr. Massian's clinical trial on the radio. And I called to find out what was involved. I thought it sounded like a good idea. They told me that there would be a number of different tests which I probably would have not been able to get because I really didn't have any symptoms. So I went through the testing. 3 days after I went through the tests, I had a call from Dr. Massian and met with him. He showed me my CT scan, showed me where I had a 2.8 nodule, immediately said, well, I think you need to have this out, at which point Dr. Grogan came in, and within 2 weeks, Dr. Grogan was removing my tumor.
And we'll touch base more on your story. I want you to explain a little bit more on that. But she mentioned listening to you on the radio. Where do you fit in? And because I know early detection, that is something that you really like to focus on. And so what's the first thing that people watching right now, what's the thing they should know?
Well, they should know that the face of lung cancer has changed dramatically. In the past, it had a terrible outcome, and the people were thinking, once I have lung cancer, I'm not going to survive this disease. Things have changed. We actually understand how the disease comes along. We understand how to prevent it, particularly with smoking cessation, which is essential. We know now also how to detect it early. And with the advance in imaging particularly, now we offer people who are at high risk low-dose chest CT, which is a scanning imaging, which allows you within a few seconds to get very detailed pictures of your lungs and detect disease that otherwise may be dangerous to you. And in the space of early detection, since 2011 now, we are seeing a revolution in the way we can detect the disease early. And that matters a lot because that's at a time when the disease could be resected and patients can be cured from the disease. In the past, the majority of the cancers would be detected when only about 25% of them could benefit from a cure. We're trying to increase that number, and the time will tell.
What's being done now as far as the studies? And I'm sure with your center that you're very involved in trying to stay ahead to find further treatments and to make treatments a lot better. What's happening now? Anything different? I know you mentioned obviously it's a lot of different outcomes compared to years ago, but anything being done now?
Yeah. So what's done now that's different is that we start from understanding that we can screen for lung cancer and we can identify the disease early. Yet if we do this the best way we can, we're not just detecting every cancer. So we need to improve our ability to detect the cancer among the highest risk individuals. And in my clinic, I see a lot of patients that are high risk. And among them, many of them are current or ex-smokers, and more commonly now ex-smokers. But it's still about something around 15% of people who have smoked their lifetime who will get lung cancer. And in clinic, I can't tell who is going to get the disease. So that's a major challenge. So what we're trying to do in our program at the Cancer Center is to try to identify those that are at the utmost risk. And with those people, offer them a detailed screening program. With this, we get detailed questionnaires, we get breathing function to see how the lung capacity is. We actually get the low-dose chest CT to get a detailed picture of their lung on both sides, obviously. And we also offer them eventually a bronchoscopy to look within the airways and determine whether there is anything abnormal in the airways. Now, this last part is not standard of care. This is part of a research study that we're doing to trying to find markers that could help us distinguish those that are at the highest risk.
So lung cancer, is that always now, because obviously with people who smoke, is that always associated with people who smoke, or can you get lung cancer without smoking? Dr. Grogan.
So, that is smoking is the number one risk factor, but there are a lot of other risk factors for lung cancer. People who have radon exposure, which is very common in this part of the country, are at risk for lung cancer. People who've worked in the asbestos industry, who have had exposures through the shipyards, are at higher risk for lung cancer. And then there are people who just get lung cancer that really have no risk factors. And we are certainly finding a lot of that as well. So it's not just smoking, although that is certainly the highest risk, but there are a lot of unfortunate people who get this disease. But as Dr. Massione said, if we can find it early, we can still cure those people as well.
Is there something considered early enough? What's the time frame?
Well, that's a great question. We don't know the exact time frame in the natural history of the disease, but what we consider early enough in our practice is when we can actually offer surgery. And the cancer diagnosis comes with the pathological specimens. Then we need to stage the disease to see how far the disease has gone. Early stage is considered, between stage 1 and stage 3A typically. The earlier you are, the better your chance of being cured is.
And I want to go back to smoking. If you smoked and you quit, who knows, a decade ago, is this still something obviously you'd like to at least get screened for? If you've already quit smoking and it's been years and years ago.
Right. So if actually you look at the people who get diagnosed with lung cancer today, there are more people who are ex-smokers than current smokers. And the question you're asking is a very good one. If you quit smoking, what's your risk of developing cancer in the future? In fact, the risk decreases dramatically over time, but never to zero. You remain at higher risk for the disease because of the damage that has happened in your airways. Some of this is remaining and is permanent. Now, the critical part is to encourage people to quit smoking as early as possible and prevent the young ones to start smoking. But if you quit smoking, think that you're gaining, and you're gaining time, you're gaining health, you have many different health benefits, and your risk for developing cancer decreases over time. So much that actually in the current guidelines, we don't recommend the people to be screened for lung cancer should they have quit 15 years or earlier than that.
Are you seeing less smokers out there? That may be a broad question, but is there even a study, recent numbers, are people smoking less?
Yes, absolutely. The smoking rates in the U.S. has decreased dramatically. Since 1964, when we had about 45% of the adult population smoking, now we're down to about 20%. A little less in women, a little more in men. But the smoking rates are decreasing dramatically, and that helps us decrease also the number of cancer we see over time. Now, this said, there's still one group that's still increasing their rate of smoking. This is the youth. And this is why much more effort, in my mind, needs to be put into preventing picking up the smoking habit the smoking addiction actually in that population.
All right, perfect. Thank you for that. And when we come back from the break, I do want to touch base more on your story. I want you to tell us if you smoked in the past. Obviously, we'll go delve into your story. And if you have any questions for our panel here today, obviously call the number on your screen, 615-737+. We would love to hear from you. We'll have more News Channel 5 Open Line after the break.